Hi everyone to this wonderful session on the topic of digital health made in the EU. We have a tremendous panel, tremendous experts, and we would like to deep dive into the topic of EHDS, the European Health Data Space, and the impacts and the experiences from the experts on this panel. Before we jump right into it, I'd like to briefly introduce to you our panelists, and I'd like to start with Annabel Seebohm, who is the Secretary General at COSIR, the European Trade Association for Medical Imaging, Radiology, Health ICT, and Electromedical Industries, right? Perfect. She has a strong background in the field of representation of the medical doctors on EU level and combines therefore the perspectives of the healthcare providers, but also the healthcare users, which is a very interesting aspect in today's topic. So welcome to you. We also have Dr. Stephanie Weber from the BfArM, medical doctor by training, but also 20 years experience in the field of coding, terminologies, and the field of interoperability and semantics. She's head of department coding and registries at the BfArM, and is also active on the national, but also on the international level, which in the WHO, for example. We have Sebastian Zilch, a person I don't have to introduce here at the stage at DMEA, I hope. He is head of the Directorate Gematik, Telematic Infrastructures and eHealth at the Ministry of Health in Germany, and has a strong background in the industry sector, and has also a strong impact in the last years in the German healthcare policy, and will introduce us to the German and national perspective on this great topic. We also have a virtual guest, Martin Dorazil. Please say hi to Martin. I hope you can see us, or hear us at least.
Good afternoon. Yes, I can hear you and see you very well.
Perfect. Martin is Deputy Head of Unit Digital Health and European Reference Networks at DG Santé at the European Commission, and has more than 20 years experience in the European Commission in terms of patient aspects, medical devices, and other topics in the field of digital health. So, as you can see, we have a tremendous panel, tremendous expertise here, and we would like to deep dive on insights, on the experiences, due to the fact that the EHDS is now ready in the legislation, and we want to focus on the impact side, which we will see, and what can we use in the next 5 to 10 years from the different kind of perspectives. And I'd like to introduce you to the European level first. So Martin, it's a tremendous and ground-shaking success, the EHDS as it is right now. So you have been very active in the last month. So please, could you share with us some insights how the European Commission experienced this tremendous paradigm shift for the political agreement on the EHDS?
Yeah, thank you. Thank you very much for the introduction, and good afternoon, everybody. I have to say, I mean, the timing of your event could not be any better with regard to the European Health Data Space, because we just recently, a few weeks ago, reached the provisional political agreement among the EU institutions of the European Parliament, the Council, where the EU member states are represented, and the European Commission on the final text of the regulation on the European Health Data Space. It still needs to undergo the final formal approval process, or the final steps in the approval process. So on 24th of April, we are expecting the European Parliament to vote in the plenary on the final version of the proposal. And once this final approval is provided by the European Parliament, then just the final linguistic adjustments will be made, and the formal approval and entry into force of the regulation is expected after the summer this year. So we are really in the very final stages of the legislative process, and the European Health Data Space is a very ambitious project, but also a project that has a potential to fundamentally change the ways how healthcare operates for now, and bring many benefits to different stakeholders. So we expect in the first place, that the European health data space will make it easier and better for the citizens and for the patients across the EU to have easier access to their electronic health data, and to exercise better control over their data, so to decide who can access and how can access their data in electronic form. It will obviously also make life easier for health professionals, as they will have a quicker and easier access to the data they need to provide the right diagnosis and treatment to their patients. It will avoid, for example, duplication of certain medical procedures, duplication of tests and examinations, and also will lead in the long term to the savings for the healthcare systems. But besides the area of provision of healthcare and the benefits that I mentioned, the second important pillar of the proposal is the new framework for the secondary use of health data. So the European health data space will make it easier for researchers, innovators, but also public authorities such as health policymakers or health regulators to have access to the data they need for their project and their activities and their informed decisions. So this will bring in a medium and long term important benefits for the development of medical research, but also should improve the decisions of health policymakers and health regulators. So we are now moving from the stage of designing the European health data space and providing the legal framework into the second crucial stage, which is the actual implementation. So making it a reality, and that will be the focus of our activities in the European Commission, but also the activities for which we need the engagement and involvement of the member states experts and from other stakeholders in providing the implementing measures and making the whole system work. Thank you.
Perfect. Let's focus on this topic of implementation. So in your point of view, for the experts sitting here at the DMEA session, what is the most important aspect round about the topic of implementation, which every one of us here should know?
As I said, the implementation, there are two aspects of the implementation that are equally important. The implementation needs to happen in a timely manner. So there are certain deadlines that are set out in the legislation, in the new regulation. So we are moving from the currently voluntary collaboration among the member states in the context of the existing e-health network, where member states are participating on a voluntary basis, to a system where the participation of the EU member states is required by the new regulation. We know that some countries are more advanced, so to say, than the others. There will be an important element of preparations for those countries that are a little bit less advanced. But besides the timing issue, we also need to make sure that we get the things right, and that we have the right input from the experts in the field. So we are trying to mobilize the existing expertise from the member states. So we are launching so-called joint actions, where we are bringing together the experts from the national authorities that will provide the groundwork for the implementing measures that later on will be formalized by the Commission by adoption of the formal implementing acts and implementing and delegated decisions. So the two aspects I would emphasize: it's the quality and expertise that we need from all the sources, and also the timing issues, because time is also of essence here.
So to say, many steps necessary right now. In your terms, in your perspective, what will be the first effects that will matter for the most of the European citizens, which they notice firsthand on the EHDS?
as I said, I mean, this is still a process that will include several steps. After the entry into force of the legislation, there will be a certain transitional period. Some of the provisions of the regulation will enter into application 2 years after the entry into force. Some of them later, after 4 years, and some of them even later. So it will be a gradual process. For the citizens. There are two important, parts of the proposal, as I mentioned. In the area of primary use of health data, they will have right to have access to their electronic data immediately and free of charge, and they will be able to control who has access to their electronic health data. For example, they will be able to decide if they want their data to be transferred or provided to another healthcare provider. That this is done in a easy way. At the same time, what is of critical importance here is that the EHDS regulation provides guarantees and safeguards for the protection of the privacy and full protection of the personal data of the patient. So there's a number of safeguards included in the regulation, including the need to comply with the latest and high-level cybersecurity requirements and standards. There are also restrictions on who may access the data of the patient. So those will be only healthcare professionals that are treating the patients. So only authorized participants in the system will have access to the electronic data and so on. There is a full compliance requirement with the GDPR requirements and so on. But for the patients, the immediate benefits will be, easier access to their electronic health data and better control over who can access it and to whom they will provide it. So this will lead, as I explained, for example, to quicker provision of healthcare, avoiding duplications and repetitions of the same medical procedures and examinations. And in the long term, obviously, patients and citizens in general will benefit also from the secondary use of health data, where certain treatments and new therapies will be provided earlier due to the better and easier access to the aggregated data for researchers and health innovators.
Thank you, Martin. So let's switch perspectives to the national level. Sebastian, of course, the German Ministry of Health was engaged in the negotiations. Would you like to recall a dedicated moment from this negotiations which impressed you?
Well, thank you very much. I think, first of all, we're very proud that the European health data space is actually coming into existence, and it goes back to an initiative during the German presidency of the Council in 2020. And considering that it's only 4 years' time until the end of the negotiations, I think this is actually something that not everybody expected along the way, because there were really intense negotiations. Not because the idea every nation shared in creating that common space was an issue, but about the details. And I think everyone from their national context knows what that means when you bring all the nations together and have them discuss that. I think for me, it's a breakthrough that we actually have consensus here and that we have a compromise and that the EHDS is actually about to come to us.
Impressive fact. Talking about the implementation, what is needed right now from the healthcare system side, but also especially from the healthcare industry side, to do the next step to enable the cross-border exchange of patient data?
Like Martin has pointed out, the idea is that as an individual, as a patient, you can get the best quality of treatment across borders within Europe. That is something we want to achieve. So in order to make this happen, we of course need the infrastructure in place. We need to be able to use MyHealth EU infrastructure to exchange this data in a secure way. So also to create trust in the system, that is of the first priority. And second is we need to have data that is standardized and transferable between these countries. So I think especially here, we're here at an industry trade fair, it is very important that standardization is taken into consideration and implemented and therefore we can actually make this use case happen.
There has been recently a legislation, the Digital Act, DGG, everyone knows in the German sector. Talking about legislation acts, what will be the next legislative act you see to prepare for the further mandates foreseen in the EHDS?
Well, I think first of all, there are several measures we implemented in Germany to actually prepare for EHDS, and it was also a very delicate discussion because during the time of the lawmaking it was always like, what about EHDS? And we're like, well, we have that on our mind, but we still have to do our own legislation in line with what is to come with EHDS. So we're very happy not only that we have the digital health strategy, which basically outlined already this treatment opportunity across borders, but we also have the Digital Act, which at its core has the EPA, so basically the personal electronic health record, which is basically the instrument we will use to have this cross-border treatment being possible. And we're also very happy that we are quite close to the regulation of the EHDS and that we can, without giving up the fundamental principle of the Digital Act and the electronic, the EPA, adapt to what is needed from the EHDS. And also in the secondary data segment with digital GDNG, so translated to English is always a bit tricky. So it's like the Health Data Use Act, as we call it, basically preparing for the proper framework for also secondary use. So what we're doing now, there's a lot of implementation acts within EHDS, so we will definitely address them, and colleagues are still having, you know, warm hands from typing up all the acts. So we are currently seeing what exactly we have to do, and this will be part of further legislation. We'll also probably have some of it in the next law addressing the Digital Health Agency in Germany. And
did I get it correctly that this topic is also included in the national strategy?
Yes, absolutely. It's in there. It's addressed there. The European connectivity is an important factor because in the end it is about the individual getting the best care possible, and there I think national borders is just like an artificial border to that treatment process, and I think within Europe at least we're going to make a huge step ahead for the care purposes, but also for research purposes, because that is something no other country or continent in that respect has to offer, and I think this is a major step forward.
Yeah, I also think there's a tremendous achievement to have this national strategy to focus on that topics. Talking about the industry, Annabelle, I'd like to invite you to the discussion. In your terms and in your perspective at EU level, what will be the impact of the EHDS on the health market in the EU?
Thank you very much, Stefan, also for the invitation. Well, I consider the impact very promising from 2 points of view. When we look at the primary use of health data, of course, there will be a pan-European market for electronic health records based on the prescription by the law. So there will be a lot of going on in terms of development. And from a second point of view, we also participate in the secondary use of health data, meaning we're allowed to do research with health data and participate in the space with the aim to improve our products and services, with the aim to really improve innovation, with the aim to improve patient outcomes, to improve systems, to make systems more efficient, ultimately then to have better outcomes for patients. So better products, better services with the secondary use of health data. I think this is even the most promising part for the market.
How would you assess the awareness of the industry about this topic?
Assess the
awareness of the upcoming EHDS.
At least in my membership, the awareness is very high, and of course I expect that in any national trade association the same is going on. People are discussing, and I think it's also a very prominent debate in Germany already. So I think people are aware. Of course, it's still a bit up in the air in theory, But there's a role for trade associations here to make sure, invite people to round tables and tell them, listen, this is coming, we are preparing now, these are the requirements in the annex of the legislation, you've got to do this and that. Yeah, this is the task of trade associations such as other organizations to prepare their members to make sure their systems and products and services run soundly.
So, in your opinion, what is the best first step to prepare for the implementing, and for even to start to implement from the industry partners the EHDS aspects?
Absolutely. Yeah. I'm considering three things, and of industry is expected two things first. And you see it here in the hall everywhere. Everywhere it says independent, interoperable. Almost every booth has this kind of claim hanging from the ceiling because the law prescribes interoperability. The law prescribes vendor independency. So that is something we have to take seriously and make sure members or companies develop solutions which are interoperable. So standards come into play and are very important for this. Secondly, we wish to keep and we wish to generate the trust of the public to not opt out neither from the primary use nor from the secondary use. Now, in order to generate and to keep trust, which is a very difficult task, my members, again, and the industry has a key role because we have to serve for data security and cyber security to make sure systems and processes and data are secure. So this is another key task I think everyone needs to work on. The second aspect is we need to make sure the industry understands the new obligations coming in with the European health data space. And when you're a manufacturer, developer of electronic health record system, you need to understand which route to take. Are you on the route of the medical device regulation because your system actually is a medical device? Or are you on the specific European health data space route with other obligations? And I think it's still self-certification we're talking about. But this you need to understand, and you need to understand which type of obligations you have to adhere to. Secondly, if you participate in the research of improving your products and services, meaning in the secondary use of health data for research purposes, is your IP affected? I mean, when a data access body comes to you and asks you, please deliver this and that, because you're participating, is there any IP related you're concerned about? Yeah, but you need to understand what is actually affected. And thirdly, to improve ongoingly the working of the space, let's say the concept as such, you need to provide feedback to your trade associations, to the ministries, to the competent authorities to make sure also glitches, problems are notified and can be corrected. The third thing I think we can prepare for the industry is really plan for and participate in projects you wish to see, you wish to, for a product or a service you're in charge of to become better, because the space offers you the opportunity to improve that. So plan for projects, and these projects are ongoing. Also at COSIR, we're part of a big public-private partnership which is called the Innovative Health Initiative. I'm sure there will be projects also in the future which are cross-sectorial, which are about health data sharing, where you could feed in with your product or service to make it better and do research on it and participate in such projects. So I think, plan strategically ahead what you could do with the data from the space.
I'd like to deepen that point. Would you like to point out any experience or do's and don'ts from your experience at COSIR for this kind of engagement initiatives?
In the Innovative Health Initiative?
For example, what was your experience? What is, in your opinion, the do's and don'ts in terms of engaging at this level?
Well, for now, there is no project around the European health data space and the Innovative Health Initiative. I don't know, I don't quite understand you.
You talked about the IMI, so...
IMI, the predecessor initiative. We were not involved in IMI because I'm representing medical technology sector, so you need to ask the pharma industry. But of course, we are now sort of the newbies to this initiative, but we are successfully participating in it. It's running since 2021, and we are now at call 5 and preparing already for the next calls ahead, and I'm sure there will be topics coming up also on digital health. That's why I said, one need to think ahead whether to make use of such projects, whether there's potential for projects in IHI where you can bring in your ideas.
You worked a long time for the medical professional representatives at the EU level. In your opinion, which aspect of the EHDS will probably make their lives easier?
Yeah, and Martin, you said that already because you said you can avoid duplication of treatment interventions, and some of the interventions can be even harmful. I mean, why would you do a test or an intervention twice if it's been done once successfully? Now with the electronic health record, which is readable across Europe, you have comprehensive health data at hand, centralized, you can draw conclusions from it, and you can improve your treatment planning. So that's a clear benefit for doctors. At the same time, I can understand, and we need to make sure that for the primary use as well as for the secondary use, systems and infrastructures are intuitive, because one thing the profession and the workforce cannot deal with is even less time, even more bureaucracy, even more over-regulation, and they lose time on documentation instead of treating patients. So that is their key concern, of course, that it remains manageable and intuitive, I suppose.
Talking about medical doctors, let's bring in Stephanie's experience. So I guess you could say that the secret sauce of the EHDS is semantics and interoperability, and that's your big topic. So in terms of the BfArM, your organization, how do you already contribute to this kind of topic, and what are these ongoing actions you do at the BfArM?
Thank you very much for the question. Thank you very much for the invitation to this panel. I think talking about EHDS, we have to keep in mind that this has been prepared over a long time, and there's already lots of actions that have happened before this law is now written. So the discussion on the exchange format of the electronic health record has been ongoing for a long time, and the key primary data elements that are in the new regulation have been prepared on a European level for a long time, like the patient summary and lab results and so on. BfArM has been engaged in this discussion, and by law is mandated to make sure that semantic interoperability for the cross-border exchange is taken into account and that is secure for the structures that are set up to exchange the data physically cross-border, so the national contact points. We have tried at BfArM to bring together these two worlds that we're seeing, the German world of documenting mainly for reimbursement, for specific use cases in different sectors with different tools, and then the new European thinking of a common semantic strategy, bringing all European countries on board, documenting in the same standards and agreeing on the same standards. So we have tried to engage all the different stakeholders in these discussions in preparing these documents that are there already for the European health data space and that just have to be transferred in implementing acts and then could be used. So we hope that in the near future, this work that BfArM has done before will come into more effect than it is now.
We also hope so. The use of medical terminologies is a core component of the FAIR data principle: findable, accessible, interoperable, and usable. So in terms, talking about the EHDS, what can we expect in your point of view?
I think the interoperability and especially the semantic interoperability will have to bring many systems to change their thinking about how to capture the data. We see many systems having their own way of coding, standardizing the data just for their system. For the exchange between systems, this will have to change. And I think that is a little bit underestimated yet how big of a change this would be across Europe to bring this together. In the discussions we had, we saw that many countries have long-standing systems where they build lots of infrastructure upon, and that they're not comparable between countries yet, and that this would have countries to change completely, for example, in lab results to their way of communicating on these results. I think that there is a lot of potential in this, and especially Annabelle, as you said, you don't want to have extra bureaucracy. This potential comes with the possibility that documented data doesn't have to be documented again and again and again, and for a different standard and a different system, but you can document it once, you can reuse, you can really follow the data through the patient journey in the same standards, reuse it, and this will hopefully reduce bureaucracy and help the systems as well to be faster and better in patient safety regulations, in ways of resolving the data. And another aspect, I think, that with the EHDS comes in now is the secondary data use, where now we have all the different sources for secondary data use that we have to bring together. We have initiatives like OMOP or mapping initiatives, but we lose a lot of detail on the data when we bring it together by mapping, by reducing it to a certain level. And if we collect the primary data on a very standardized, very good, compatible level, and we bring this data into the secondary use, the benefit will be immense. That will take some time, I fear, and a lot of work to change all the systems, but the benefits, I think, are really tangible and written in the EHDS, so that it should be possible to convince all the developers of IT systems and the users to follow this path.
You already talked about the benefits of coded and structured data. In terms of your experience and your expectations, what do you guess is the most prominent effect on the first hand in terms of using structured and coded data in the German sector?
As I said, in German sector, data capture is quite fragmented. So if you look in the hospital sector, there is some standards for reimbursement, for example. It's different in outpatient care. It's different in registries. It's different in research projects. And already big research projects like the Medical Informatics Initiative tried to bring data together, and they had lots of hurdles to manage to bring enough data together to really make big data work on the data they have. I think there really lies the benefit as well for Germany with the EHDS, that we can take this initiative, and we're kind of on a, I would not call it tipping point, but maybe on a moment where when we change now the systems anyway to cater to EHDS, we can make the systems better for the German interoperability as well, and maybe have less bureaucracy, have less hurdles to compare the data, and to really make this secondary data use and the benefit for the patients that we can learn from the research finally come into place and become realistic.
Thank you all so much. We talked about insights, you shared your thoughts, you shared your experiences. I'd like to focus now on the expectations. Stephanie, you already mentioned it's a long road to go, but in your terms and especially in your experience, how does the healthcare system or healthcare looks like at European level and for German healthcare providers and users in a time frame, let's say about 5 to 10 years?
Yeah, I think when we talk about semantic interoperability, we can't really talk about a year or a month. We really have to take into account that changing systems takes quite a while. So I think in 5 years we'll still be on the road, but we have some benefits. My ideal or my hope for where we are in 10 years would be that data captured for me as a patient in my treatment, I can reuse in any European country, wherever I travel, wherever I go and work. The treating persons can understand me, and from my data, the treatment itself for whatever, hopefully not disease I will have at some point, will be better because the data is available from all of Europe, and this huge amount of data that we can bring together and work on will help my own treatment because we know more about how to better treat, how to use specific therapies. So I think in 10 years, ideally, the software systems will be mostly interoperable throughout Europe, at least on a data level, that they have all functionalities where data can be exported from one system to the other, no matter which sector we're in, if it's outpatient, inpatient, if it's research, registries, and so on. And that we have platforms and discussion forums where we can further develop this and keep it updated and have European agreement as well as national agreement on what to use best, what is for the best for the system developers and for the patients to capture the information we really need. That's quite a vision, I know, but I'm still hopeful that this new legislation would provide the grounds for this.
Promising vision, at least to me. Annabelle, what are your expectations regarding the time frame of 5 to 10 years, and what will be implemented, and how does it look like?
I wouldn't be too overly ambitious, and I would differentiate probably between the electronic health records, which are transferable and portable between European countries, and the secondary use of health data. Because for the primary use of health data, I think that maybe, I mean, this has long been planned for. MyHealth EU exists for a long time. I'm not sure, Sebastian, how many countries, member states have set up the infrastructure by now, probably 15. I think the aim is that by 25, I'm not sure. It used to be 10, but I think the plan is by 25, but Martin will know, by 25 that all member states are in the MyHealth EU. So I think here we have a closer time frame, whereas for the secondary use of health data and let's say the use of health data for research purposes other than consented to, I think we should take it step by step. Yeah, as I mentioned, look into projects. We have currently a project which yesterday just opened its consortium again. It's called EUCAIM. It's a federated infrastructure for building up an infrastructure for sharing imaging data, cancer images. So that is a project, yeah, where you can contribute, you can set up the space for specific sharing of cancer images, and this is how you could start, yeah, and it goes step by step, and along the way you improve and you make experiences and you can improve the system of that secondary use scenario. How long it takes, I don't know, but I would suggest do it step by step.
Step by step is always good. So Martin, asking one of the architects of the EHDS framework, what is your expectation on the time frame 5 to 10 years and the implemented effects we will see?
Yeah, thank you very much. Maybe I'll start, answering a little bit more general. I would like to come back to what Stefanie said, and I cannot agree more than, digitalization of healthcare as such and the European data space, it is a change, and every change requires initial effort and initial investment. Investment in terms of, in financial and monetary terms. So, for example, investments in the infrastructure for the exchanges of data, but also investments in terms of changing the mindset of the health workforce, trainings, capacity building, and getting used to the new way of doing things. And clearly, I mean, we will need this initial investment, but I'm convinced that very quickly, I mean, we will see already the benefits. And I hope, now coming to your question, that in 5 or 10 years, the benefits from having the health data in a standardized format. So having, electronic exchanges of e-prescriptions, patient summaries, lab results, medical images, discharge reports, and so on. I mean, that we will, in 5 to 10 years, definitely see the benefits outweighing the initial investments, both in terms, in financial terms, but also in terms of investing in the new trainings and capacity building, and then learning how to things, how to do things differently. Because definitely doing, things right from the outset. So having the data inputted in the right format that is interoperable and interchangeable, will save a lot of efforts, a lot of work, but also a lot of money in the medium and long term. So that would be my answer to your question.
Thank you so much. So last but not least, Sebastian, talking about 5 years from now, what do you hope for and what are you expecting for this great change we are talking about? Martin said it's a change management. What do you think?
Well, I think that EHDS implementation mustn't become the next GDPR implementation, where basically the evening before it was compulsory, everyone was like, oh, wait, we have a new regulation on the horizon. What do we have to do? And then everyone was panicking and trying to implement something, and it was a big pain. So I think EHDS and having this forum here, I think is a very important first step. We have to prepare for EHDS today. We have to work towards this, and this means like a shift of mindset. We also have to think that primary use of data and secondary use of data cannot be thought separately and individually, independent of each other, because it's one thing. It's not only have like good care and then use that for research, but also take research results back to care. So I think this is a general mindset shift which we need to have. And what will be in 5 to 10 years? I think we will be on a journey still, that's for sure, but we will be much farther than today. And what do we have to do? It's, I think, basically 3 areas. One area is we need to be technologically ready, which means the systems need to be ready. We need to have EHRs up and running. We need to have interoperability, which is basically leading to the second part, data availability and usage, the FAIR principles, you mentioned that. So we need to focus on that and increase interoperability standards. There's a lot we do in a national level in Germany today, and I'm sure other countries do the same thing. And there's also a mutual exchange with other nations. How can we get better there? So that's the second. And the third is that we need to be ready for what comes out of this, which means processes, interaction. And I don't only mean, you know, to prepare a clinician to deal like with the information they get, you know, in a standardized and translated so that they can actually do the treatment, but also to understand as a patient what happens with my data, to trust that it is a good thing to share health data and use them in a collaborative way, even across borders. And I hope that in 5 years' time, we'll be much further there, and this will be like general consciousness, everyone will be aware of it, and we are ready for EHDS to go live.
So I buy your vision. Thank you all for sharing your insights, your thoughts, your experiences. I hope you enjoyed this great session. If you want to meet the experts, please come in 45 minutes to the booth of BfArM. You have the chance to talk to each of them and to deepen the one or other topic. So thank you a lot and enjoy your rest of the day. Bye-bye.